All right, I do see that there are folks still joining, but we're going to go ahead and get started. So thank you all so much for attending the session today. As you probably know, the session is titled HIP Outreach and Advocacy, What Role Can My Organization Play? My name is Gabrielle Witham. I use she, her pronouns, and I am the Assistant Director of Community Partnerships at Project Red. So while Project Red is convening this session, it truly is led by our partners. So our partners are from the Food Project, Regional Environmental Council, Groundwork Lawrence, Mattapan Food and Fitness Coalition, and the Massachusetts Food System Collaborative. And all of these folks have been working directly with the Healthy Incentives Program since the very beginning. So here with us today, we have Annika, the Community Programs Manager at the Food Project, Grace, the Director of Programs at Regional Environmental Council in Worcester, Maria, the Healthy Living Programs Manager at Groundwork Lawrence, Chevelle, the Executive Director at Mattapan Food and Fitness Coalition, and Becca, the Campaign for Healthy Incentives Program Funding Coordinator at the Massachusetts Food Systems Collaborative. So our goal for today's session is to provide community-based organizations with tools and best practices to promote the use of the Healthy Incentives Program among your clients, patients, consumers, or community members. While HIP has been an incredible resource for folks to be able to buy more healthy, affordable, and culturally relevant produce, most HIP retailers can attest that using the program is at times difficult to navigate, especially for folks who may have limited English proficiency or who haven't visited a farmer's market before. So today we'll be reviewing some of the basics of HIP and how to use it, how agencies can promote it with your clients and support them to be successful, and how to use stories and data to support advocacy efforts around HIP. So the partners that we have here today are all sharing their perspectives as HIP redemption sites, farmers markets, mobile markets, and CSAs, and how they've tried to spread the word and make the process easier for clients. But the people working outside of the local food system understand, the more people who are working outside the local food system understand how SNAP and HIP can be used at these sites, the greater the impact the program will have on food security in the state. And the more that it's understood and utilized, the better case that we can make as advocates to ensure that it continues to get funded. So at the end of the session today, we hope to reserve about 5 to 10 minutes for questions for our speakers. As they're speaking, feel free to put questions in the chat, and Maria from Project Red will select a few to read at the end. But since our time today is limited to an hour, we do ask that you refrain from coming off mute with questions while our presenters are speaking, and just instead use that chat feature for this purpose. So now we're going to get started with a HIP overview. So Becca Miller from the Food System Collaborative will begin with a brief overview of what HIP is and how it works.
Thanks, Gabrielle. So hi, everyone. Thanks for joining us today. My name is Becca Miller. HIP is an extra incentive that puts money back on an EBT card when you're using SNAP to buy healthy local fruits and vegetables from HIP farm vendors. It's been around since 2017, and clients and community members can earn up to a monthly cap of $40, $60, or $80. If you live in a SNAP household that has 1 to 2 people, you can earn up to $40. If your SNAP household is 3 to 5 people, you can earn up to $60. And if it's 6 or more, it is $80 per month. So HIP can be used to purchase eligible fruits and vegetables that are, of course, fresh, but also canned, dried, frozen, in seed or seedling form, and in other, preparations without added salt, sugar, fat, or oil. So that's the basics of what HIP is. Can you go to the next slide, Gabrielle? And HIP can be used at these places. So at farmers markets where some or all vendors may participate, we'll go into this a little bit more detail later. At farm stands, at mobile markets that go around to different sites, and in community-supported agricultural share programs, or more commonly known as CSAs, where you sign up at the beginning of a season and then receive a box of produce every week for a set amount of time. Next slide. And most importantly, how does HIP work? So the number one thing that clients can often run into is you need to have a balance on your EBT card to access HIP. That we'll go into a little bit more detail later, but having a balance on your EBT card is really crucial because if your card is zeroed out, then you can't earn HIP, unfortunately. Just like, you know, any other store, you pick out the eligible produce that you want to use, and you pay for your purchase with the farmer or the worker at that farm stand or mobile market or farmer's market. Once your card has been swiped, the money will come back right onto your EBT card, and you can check your receipt for HIP earned, which again is a little tricky, and will show you what you've earned month to date. So that's a really basic overview of how HIP works in a market transaction. And I will pass it over to Grace and Ashley at the Regional Environmental Council.
Hey, everybody. So what do customers need to know? Unfortunately, the program of HIP is a little nuanced. So as Becca mentioned, keeping a balance on your card, the way the HIP program is designed is it's an earnings program. So the catchphrase is to use SNAP to earn HIP. So when the customer does use their card, they do need to have a starting balance. They do not need to have the full balance. So if a customer is eligible for $40 a month, they don't have to have the complete $40 on their card. There is a way to do multiple transactions. So if you're spending $10 that day and you have $5 on your card, the vendor should be able to do 2 separate transactions to allow you that $10 renewal of benefits. The benefits versus HIP renewal dates, that often also confuses people. Right now, SNAP participants get their monthly balance renewed every between the 1st and the 14th of the month. The HIP renewal is every 1st of the month, so it's calendar. Every 1st of the month, they can have that renewal of $40, $60, $80. But again, they have to have their balance. So some folks might get be eligible for more HIP money on the 1st, but they might not have any money in their SNAP balance to make that purchase. For folks to know how much HIP money they have to spend, the DTA tracks HIP in a balance opposed to, of how much you've used opposed to an actual balance of how much you have left. So when customers call the DTA line to find out how much SNAP benefits they have, HIP will come as HIP used to date. So many people may call and they would receive the message of you have $0 HIP used to date. It doesn't mean that you have no HIP money. It means you haven't used any. So it's a little bit of a subtraction process. So if you get $40 a month and it says you have 0 used, you have your whole 40 to still use. If it says 15, that means you have $25 left to use if you're receiving 40 a month. Another thing customers need to know is their family size, or at least how many people, household size rather, how many people are connected to the card. So if you have a cousin that moves in and you say we have 3 people in your household, but DTA only has 2 people in that household, you're still only eligible for the 40. So it's another reason to update DTA on your household size. As Becca said, 3 to 5 would be 60, and then 6+ would be 80. So knowing how much you are eligible for every month is really important. The receipts will also show you how much HIP you used that day, and then how much is your balance. And you should always be getting a receipt printed when you're making a transaction at a HIP location. Finding redemption locations, HIP versus non-HIP vendors. There are some places like farmers markets where there's multiple farmers, and in not all markets does every farmer take HIP. So I'll pose an example. At REC markets, all of our vendors are eligible to take HIP because we can do the transactions for vendors that don't have their own machines. But at some markets, it's if a farmer has their own machine, but other farmers do not, you do have to ask or look for that symbol. Hopefully you don't have to ask, actually, and you can just see the sign. Folks that carry HIP or HIP eligible vendors should be having a sign out front. A couple other things that aren't listed here, I'll go quickly just because they weren't included. And these kind of cover some SNAP things too. A reminder that other people can use your card. You should never have to show ID when you're using your SNAP card to use SNAP or HIP. When you're getting SNAP or using HIP to make a purchase, so for example, if you've done some pre-ordering, like we had to do during COVID, you do have to pay at the time of pickup. It can't be over the phone or ahead of time. That's important for vendors to know, but also customers. Yeah, those are the other two I wanted to include. Thanks.
All right, so now we'll transition to a conversation about how to do outreach around HIP. So it's really, really important to kind of understand the basics of the program. As Ashley and Becca explained, you know, there are some nuances to the program. So that basis that that was just discussed is really important to be able to help folks to use the program effectively. And I did see a question in the chat about the slides. So the slides will be made available after the presentation as well as the recording. So if you missed that first part where folks really went into depth in how the program works, that will be available after the fact. So now we will transition to a conversation about how to do outreach around HIP.
Hi everyone, I'm Annika from the Food Project. So a little bit about our existing resources and how we decided to do outreach. Towards the beginning of our experience, we did a lot of stand-in or thinking about like farmers market, actual locations. We would hand out flyers and have conversation with folks, a lot of the permanent locations that we were at. And so that helped a lot with the folks that would come to the market. And through administering evaluations and surveys, we were able to kind of think about more ways and better ways to do our outreach. And so thinking about making materials in all different languages to make sure that folks in the communities are able to understand the information and have access to that information. And then we've also started to work with more of the coalition groups in Lynn and thinking about organizational partnerships, community events, social media, and of course, face-to-face interactions. So it's a lot of conversations and talking with folks about their experiences, about different questions that they might have. And we're also currently working on a HIP campaign now where we've decided to kind of think about what materials are necessary for folks to have to be able to understand this program, and then how can we distribute that and share that with our partnering organizations. And so that's what we're kind of doing now, to think about how we can spread the information and have other organizations and partners be able to explain and use their communities as well. And so below we have a couple of resources that I think will be come up throughout the slides, but the MassGov website has a lot of great information on starting out on HIP, the DTA map finder to be able to figure out where different vendors are. And then we also direct folks that have more questions about SNAP and EBT to the Project Bread website. And just to kind of back up, one of the flyers, this flyer that you see here, was actually a flyer that was created by our youth programs, our interns last summer. And so they've been participating and thinking about how we can better translate the information and get the information out to the folks that aren't aware of it at the moment. So thank you.
Annika, I'm going to put you on the spot for a second, but can you explain to folks, what is in that DTA finder? Because I know that it's kind of a mix of markets and vendors and mobile markets and things like that.
Yeah, so the idea of that DTA finder is on the website has a map on there, and you can put in your local zip code or different town or city, and it's supposed to be able to show you all the different farmers markets or different locations of where HIP is accepted. And so usually I have all the farmers market, mobile market locations, sometimes CSA pickups locations and stuff like that.
Thanks, Annika. And as Ashley was mentioning, even if a market is listed on the DTA finder, that doesn't necessarily mean that all of their vendors accept HIP, which is something important to remember. All right.
Yeah, so building off what was talked about over in Worcester, we're really excited for the materials the Food Project are developing. John's been talking them up to us, so we're going to be excited to distribute them as well. We found a lot of effective tools for HIP outreach are pretty simple. So paper flyers, banners, and signage. So you can see in the top part of the image here, really large format banners that we put up the whole season at our standing markets. Also use lawn signs. We found in terms of multilingual outreach that there's key parts of flyers and outreach that are important to translate, and there's other parts that can kind of stand alone. Our market schedule, for example, that's something that most folks are able to access pretty easily. We've also done some experimenting with advertising. So in Worcester, we got some support from the Division of Public Health to do a campaign on our public buses, promoting and explaining HIP, which we got a lot of positive feedback on. We've also worked with Centro, with El Vocero, which is the largest Spanish language newspaper for Central Mass, doing some educational campaign and advertising with them. I think another piece that's really key is working with community leaders and partners. So in Worcester, we have some experience both with supporting community members through employment as SNAP outreach champions via RAC, where we worked to recruit folks and hire them to go out in the community and spread the word, but also finding folks who are in those roles for other organizations and other programs, and then providing training and resources for them. So we've got a lot of folks in COVID, different organizations who've created something they call health equity champions, health outreach workers, roles like that. Those are folks that can be really great advocates for HIP, and providing a really simple training, something similar to this, we found to be pretty helpful. We also have gotten some support locally to do a series of focus groups, doing multilingual focus groups for outreach, including a mix of folks who have used HIP before and folks who are not familiar with the program, to have some conversation and space to discuss it, answer questions, and also for us to get feedback as HIP retailers on what would make the program more accessible. Social media, and then also looking at community-specific video and outreach campaigns. And I'll just add for the DTA HIP Finder, I know the feedback I've gotten is there's a concerted effort this year to really make sure that tool is very up to date, but always important to know that farmers markets, unlike brick and mortar stores, the schedules will change seasonally. So checking the market start date, checking the market end date. For us, we have mobile market stops, so we're on the DTA HIP Finder, but our hours of operation for a single site are only 90 minutes per week because we go to 12 stops weekly. So having that is just something to know for clients.
Hi, now we're gonna talk about some outreach tools that we use here, and it works for us. We have networkings. We do tablings at DTA every week, at least once a week. Now during the pandemic, we hasn't done it, but it's really a great way to outreach the programs. And also we go to WIC office and talk about the people. Some people doesn't have SNAP. They could, we talk about that and how they could apply for SNAP, and then they will get the HIP incentive. We do outreach like at the senior center. They invite us when they have church meetings, like events. We basically outreach all over the place, but it's good to like tap in there, go to the churches. Neighborhood meetings is a good way to do outreach. You know, there would be families that are not in DTA, that they don't have SNAP, and you could talk about how you could involve also over there, community events. We have community gardens here that I do events with my gardeners. I also talk about an outreach to HIP incentive. I'm a SNAP over there. At the clinic, they do events and they invite us, and we also talk about the programs over there. The school, they invite every time they have parent-teaching conference, so we could talk to their parents about all the food programs that we have and how they can involve and how they can apply if they don't have the SNAP. We also do door knockings to outreach all the programs that we have. And also the most powerful ones, I think it will be for everybody, is word of mouth. When something is working and it's good, you don't need to outreach much because people will know, especially here in Lawrence, they will know.
Great. So I wanted to add in here, we know sometimes that learning about HIP can be an incentive for folks who maybe were on the fence about applying for SNAP. So perhaps those who would have received only the minimum amount and didn't feel that it was worth it to apply to go through the process. And not all organizations have the capacity to assist with SNAP applications. But so Project Red's Food Source Hotline is a great resource to have on hand for clients who maybe found out about HIP and are not yet enrolled in SNAP, who want to know if they're eligible or need help going through the application process. So our hotline is free and confidential. It's open 6 days a week. And our wait times are very short. Counselors can assist with applying for SNAP or doing SNAP pre-screens, as well as finding other food resources in callers' communities. And we have hotline promotional materials available for free on our website, so they can be downloaded or ordered at projectred.org/resources, and I will put that link in the chat right now. So now we're going to transition into a time for the partners here today to share some best practices and lessons that they've learned along the way in running HIP in their farmers markets and gardens and mobile markets and CSA programs. So as you've seen, the partners that are here today have a great breadth of experience implementing HIP and promoting it at their respective sites. They've learned a lot over the past several years about how to talk about HIP, how to work with HIP customers, and to increase usage of this program and help ensure its sustainability. So they're going to share some of those lessons that they've learned along the way, and hope that those will be helpful context for you as you're doing outreach to your clients about the program.
Hey everyone, I'm Chevelle from Mattapan Food and Fitness Coalition, and for MFFC, partnerships are key in us understanding the SNAP HIP experience for our residents. We are very lucky that our farmers market manager also works with the Family Engagement Network, so she has access to a lot of the families that we serve at our market. And this allows us to learn more about the residents who utilize that food benefit, other food assistance benefits, but just benefits in general. And so we also know before the pandemic that the amount of food benefits given to our families wasn't enough to support them. And at that market, we would often have like informal one-on-one conversations just to see about see what shoppers are feeling about their food consumptions. And some would share again that they were struggling to get their food. And these informal conversations also opened up conversations about the process of using HIP. And from this, we learned the language used to explain SNAP HIP was and is still kind of confusing, as well as the language barrier. As you know, many languages are spoken in the city of Boston and greater Boston and just Massachusetts in general, and just the world in general. And so at MFFC, we really want to stress that having individual conversations about how SNAP and HIP works is key, and the language just needs to be as simple and easy as understandable as possible. So to work on these issues, we would explain SNAP and HIP to customers at our manager's table when people walk into our market. Also, community residents who doubled as volunteers would also take the time to explain how the SNAP process worked, which was mentioned in other organizational tactics as well. And our volunteers who either spoke that language and was a user of the benefit would also show the user that process. So for example, we have one of our farmers, her name is Siona. She has a community resident who just comes and volunteers. We didn't recruit her. She came to our market one day and was like, I'm helping you volunteer all the time. So she comes and help our farmers, but she's also a user of SNAP and HIP. So she would take the time to teach the shopper who is there how to utilize that benefit as well. And so the lastly is we partnered with Cooking Matters, and we do cooking classes on our own to lead shopping tours, programs around budgeting and how to read nutrition labels, because sometimes shoppers may not know, like, what can they use with the HIP or SNAP or things like that. So partnering with Cooking Matters and hosting those shopping tours when we were able to do that in person was beneficial. And so SNAP and HIP makes it possible for residents to purchase quality meat and seafood and other things that may be expensive for them to purchase on their own. However, when some shoppers use their benefits to purchase these items, comments are sometimes made to the effect of that resident shouldn't be purchasing those things because of their economic status. This type of commentary from peers are harmful to SNAP and HIP users and creates a stigma around that. And the shopping experience for that SNAP user could be demeaning for them. And so last fall, when the pandemic was at its height, a lot of organizations were putting together focus groups. And what we learned from those focus groups is that dignity plays a factor in food security and whether or not people go out and get assistance and want to actually go through that process of utilizing SNAP and signing up for SNAP. And so we have to create that welcoming space for the shoppers. And to navigate this, we at MFFC, we promote it, we encourage it, and we show how to use it. Aside from food, the market is also a place of education, our teaching ground, because of some of our staff, volunteers, and farmers also have that shared lived experience with the shoppers who enter the market. It makes the resident feel more at ease to use their benefits and purchase that organic jar of honey that they had their eye on, or something else that may have been too expensive for them to buy. And then lastly, this summer, to understand that experience more, we plan on formally training our volunteers, which was mentioned before, as SNAP HIP ambassadors to explain to the shoppers, as well as distributing surveys just to see how their experience went.
Thanks, Chevelle. I just want to jump in here quickly and say, so the organizations here who are running farmers markets have done some really intentional planning around how to make the program as accessible for folks as possible. So if you're curious about if things like this are happening in your own community's farmers market, we would encourage you to reach out to the market manager or whoever is organizing the market to see what kind of supports they have available around using SNAP and HIP at the market. But usually there are market managers tables that are able to provide information to shoppers. And so that's usually the first place that folks who have questions can go to get more information. And usually those are well marked with SNAP and HIP signage so that people are aware.
I just want to echo everything that Chevelle and Mattapan does and mentioned right now. All of those things are so important in understanding the experience. We feel like we do our best work on the ground, and how you do the outreach is by helping customers get through that first transaction. We also have used a lot of focus groups. We did a barrage of them more than pre-COVID, and we called them charlas. They were mostly done in Spanish, and they were in a mix of communities of where there's already a market located, and then also like where a potential market could be located, to kind of gather the need and the understanding. And they were really useful. There were these small gems that would come out of it that I don't think that we would have found out. Certain perceptions of the markets or information that was misleading about the markets that really helped us gain a better understanding. Another really awesome thing that we developed was a customer advisory board. Unfortunately, COVID disrupted this, so we're going to get back at it. But we pulled together some community members that utilized the market and got a lot of feedback from them. We initially got them together through some free coupons to make sure that they could go and shop, and then kind of give us feedback on their experience, even though a lot of them had already had a lot of experience. And we sat down there. It was a good, it was multi-generational, multicultural, multilingual feedback. And yeah, that was really great. That was through some grant funding. So that was a little easier to pull off because of that. The HIP Story Project was with the Mass Food Collaborative. We were able to sit down and do some pretty in-depth interviews with customers. Again, that was multi-generational, multilingual, multicultural, and really get people's experience on paper and their story and impact as well. And I think that was really useful. We've been able to use that with funders, with outreach to political figures in the state to help with, kind of securing the funding around HIP, et cetera. So that was really wonderful too.
I just want to jump in to give big shout outs to Rebecca with Mass Food Collaborative, particularly for the story project and the support on that. And I think just really calling out how important it is to honor and value customers' time when they're giving this input, which is so important, and having appropriate resources to do that. So we're really thankful for the Mass Food Collaborative to support us in that work.
We also get feedback from our participants of the farmers market, and everybody that has experience with hips and use the hips. Here is a story of one of our customers that it's really, for her, is really important because she's a single mother, and it's given a little extra for to extend his SNAP money that she gets. And besides that, she gets, her family is able to eat local produce, which is very, very important. HITS is a really great program because it's not just help the community, but also it help the vendors in general, all farmers that are in this program. And then that money is recycled again to the state. So it's a really, really good program since the start. I think it's going to be 6th year since 17. A lot of people who just gets $15, $16. I know I haven't seen this year that lady, but she was so thankful of the HIP incentive that she went, every time that she got to the market, she just asked, can I just get $15? I say, yes, it's not a problem. You could get $40 a month. You want to use it all at once, you could use it all at once, or you could come every 4 times a month. We have market in the summer 3 times, like Wednesday, Friday, and Saturday. So I say you could come every market, you buy little by little if you don't want to use it all. But yes, you could use your 15. So, and I got a lot of elderly like that they just get $5, $10, and the HIP incentive help them a lot.
Great. So we at the Food Project use a lot of surveys and evaluations, and I think that this is really helpful with us, especially with the idea of relationship building and having those interactions with community members and market customers. And so with that, we're able to kind of think about where the gaps are in HIP, or thinking about what can we do to kind of, meet where HIP stops. And so administering surveys and evaluations like this is really helpful, just to thinking about our plans and then thinking about how we can continue to spread the information. As customers become more used to coming to the market and those relationships have been built, they tend to stay a little bit more as like volunteers. I believe that was said already. And we've also had one volunteer that's been helping in our greenhouse that actually went to HIP Lobby Day at the State House. And so as we get that involvement and have those opportunities to be able to talk about HIP, we also can kind of clear up misconceptions or any confusion around the topic, because like it's been said, it is kind of confusing to just kind of regurgitate or just speak out to somebody. But as people are starting to utilize it and you're helping people through the process, we're able to better understand, as well as the customers, and then they'll be able to continue spreading the word. Yeah, and I think another thing which is really important is just because I think it was this year or last year where it was the full year of HIP. And so a lot of this information that comes from surveys and evaluations help with changing policy and thinking about how we can improve. As we get all this information, we're able to share that to continue this work. So.
Thanks, Annika, and everyone else. So I think that's a perfect transition to start talking about advocacy around HIP. So as we all know, data and storytelling can be really compelling when it comes to advocating for programs like HIP to continue. And Annika kind of just briefly mentioned that last year was the first year that the funding for HIP was year round. So Becca, perhaps you can kind of talk a little bit about how that has shifted over the years. But direct service practitioners who are working closely with the clients that benefit from these programs, as well as the clients and the community members themselves, can be really powerful advocates. So we'll wrap up with some updates on HIP legislation and how advocates can help to ensure that this program remains as just a sustainable one.
Yeah, thanks, Gabrielle. So as everyone was already saying, this is actually the first year that HIP is going to run without interruption. Like there was a small suspension in the spring of 2020, essentially like right before the pandemic really kind of, I don't like to use the term like blew up, but like really became a huge concern locally here. And that is thanks to advocacy of everyone on this call and more folks that are not here today. So for those who don't know, HIP started in 2017, and basically as long as the program has operated, there's also been a an advocacy campaign that I now run at the Mass Food System Collaborative I'm sorry, there's construction in my neighborhood, to make sure that the program can continue to run. The program was initially so popular that the USDA funding that funded it ran out in 10 months when it was, projected to last 3 years. So that's why this campaign exists. And throughout the campaign, we like to talk about how HIP is a win, like a triple win program for local economies, right? Every dollar that goes to a low-income family to purchase fruits and veggies for their household food budget also goes directly to local food producers. So that money stays in the local economy. There's some data in our fact sheet that I can link in the chat on our website that really shows that that is a greater economic impact than if you spend it at like a larger box chain store. And it's also, improving public health and lowering healthcare costs in the Commonwealth overall. So it's a triple win program. We have been able to win more than $34 million from the state legislature over the past 4 years for this program. And one of the key pieces that has allowed that to happen has been storytelling. Like we use data of the program overall, which DTA publishes on the MassGov website, which is really great, and we appreciate their transparency. But having these stories, that some of which you've already heard from folks, to complement that data is really, really powerful. We've brought HIP consumers to the State House to share their stories directly with legislators, and these are just a couple of data points that are really helpful to share a compelling story. So if you're a service provider and you have capacity to talk to the families that you work with about HIP, trying to get their story of what makes them tick and how they find HIP to be working for them is really powerful and will help build this program for the long term. So of course we we're all just curious folks, right? We want to hear what you're cooking at home with your HIP veggies. If you have any recipes to share, those are really fun and people like to hear them. Any health effects, folks like to tell me when I've been out in the community that they've been able to stop taking medication or lessen their doses for diabetes or lost some weight, or they're just feeling better connected to their community. Like mental health is a huge concern right now, right? Connection to your community and connection to the local economy is a really important piece that can sometimes be hard to quantify, but is extremely important. If they're, increasing their physical activity by walking to the market or just walking around the market, that's also really important to share. What their kids like to eat with HIP, if they make them snacks like ants on a log or something. And if they've told friends with SNAP about HIP, that's also really important because, like Maria was saying, word of mouth is a huge tool in communities to make sure that, what folks feel is getting what we know is good is getting around to more of our community. So you can go to the next slide, Gabrielle. And so then once we have those stories, like I linked earlier to our website, we share them with legislators. So I coordinate the campaign for HIP funding, and we share stories with legislators at key points during the budget cycle. This year is the Massachusetts fiscal year 2022 because it starts in starts in July 2021 and ends in late June of 2022. So that's the operating budget, and we advocate for HIP every budget cycle. We are lucky to have gotten $13 million in this budget cycle so far. That budget is now in conference committee, so we're keeping an eye on it, but we don't have an action alert out right now. And we hope that that amount will be included in the final budget when the governor signs it later this month. And we also have a bill that we're closely tracking. It's House Bill 250 and Senate Bill 108. It's called an Act Relative to an Agricultural Healthy Incentives Program. It's basically just a bill that would put this program into law long-term. It's a no-cost bill. The program actually, funny enough, only exists in state regulations. So if there's, potentially not saying this is likely, but like if there's an administration that's less friendly to the program, this would encode it into law and protect it in the longer term. So those are the two key points of the campaign for HIP funding, that enabling legislation and the budget fight. So if you would like to get involved, we would love you to get involved. Please email me at that email. It's Rebecca, REBECCA @mafoodsystem.org to get involved. And I'll put my email in the chat as well. And I'll pass it to Annika.
Thank you. So the last thing that I was going to talk about was just a little bit about sharing stories to bring on more HIP, or to continue spreading the word about HIP with other community members. And so I think a lot of the experiences that I've had while working on the farmers markets is having those conversations with community members, sharing those stories, and then telling them to continue and sharing them so more folks are able to come to the market. I put a quote on here from one of our Boston residents, which was kind of rings true to, I think, what Maria was talking about previously, but they only receive $12 a month of SNAP. And so that $40 is really helpful for them in terms of getting their produce and getting it locally in terms of access. And just the idea of sharing personal stories are a lot more relatable. There's times where, sometimes the idea or the image behind receiving assistance for food might be negative, or feedback might be negative, but seeing other folks that are participating in the programs, hearing their stories, hearing some of the complications or the celebrations around that, I think being transparent about the whole experience is what really brings people in, and they understand that, this is a program that is meant to help us, not hurt us. And it is here to be able to, for all of us to share, and I think that that is really important as well. So thank you.
Awesome, thank you so much. All right, so it looks like we have a good amount of time for Q&A. I did see some questions come through the chat. If you have other questions after hearing the rest of our speakers discuss advocacy or outreach, feel free to put some more questions in the chat. But we can start with, Sabine asked, and anyone is welcome to address this. Perhaps Becca, you would know best, but is HIP only for SNAP recipients? Many families received PEBT due to the pandemic. Will families who have PEBT receive HIP?
Yeah, HIP is only for SNAP recipients. If you work with families who receive PEBT and you think they'd be eligible for SNAP, please encourage them to sign up.
You can use the hotline for that. Thanks, Becca. And Becca, this one might be for you too. What is the process for adding farms to the program?
Oh, that's a complicated one. The short answer is advocacy. In 2020, DTA opened up the program to new farmers for the first time in 2 years. It had previously been closed to new farmers joining the program because of budget constraints, essentially. Removing the ability for new farmers to join is like one way to maintain a relatively, clear picture of what your budget projection should be for the next year if you have all of that data. So in 2020, the program was open for a couple of weeks to farmers for applications. There were about 39 new vendors, or like already existing HIP authorized vendors, that were allowed a new point of sale. I think the REC was one of them. So we'd like to see that happen again to make sure that, like the median age of farmers is around 50 to 60 in Massachusetts. And as folks age, We know that there are reduced points of sale in specific areas of the state, so we want to make sure that those points of sale are being replaced with new points of sale. So unfortunately, that's just an advocacy thing, and making sure that we have enough in the budget to ensure that DTA feels comfortable opening up the program again. So if you are a farmer on this call and would like to be a HIP authorized farmer, please email me, because having those stories is also really effective for advocacy.
Someone had asked, Annika, I don't know if you got the chance to address this in the chat already, but I know you had mentioned some of the materials that the Food Project had developed, and someone was wondering if those materials are available for sharing, or what your process is with those.
Yeah, definitely. I can put my email in the chat, and then anybody who's interested, I'll be happy to send out the info.
Thank you. And then I know that someone had asked Ashley and Grace about that customer advisory board, and you answered at length in the chat, but I don't know if you wanted to come off mute and just share a few highlights about that.
Sure. I think Ashley covered it pretty well in the chat. We were definitely just kind of piloting what would be a meaningful role for customers to be engaging in a more formal way in kind of our program direction. And so when we piloted it in 2019, we did a secret shopper program where we recruited customers who shopped at our different markets, who are representative of the different communities that we serve. And we created a tool for them to kind of assess the markets and encourage them to shop at all the different markets we offered, and provided gift cards for them to do that. And then we had a facilitated longer conversation, which we also provided a stipend for. And we had interpreters present to get feedback and have some conversation around the shopping experience. It was really, really helpful, especially kind of drawing on the experience of folks who've been shopping with us in some cases for many years. And our plan was to continue to work with that group and to try and bring some producers to the table as well. So having some of the small farmers and urban farmers who are vendors be a part of the conversation. But we really got stymied with COVID. It was challenging to think how to reconvene that group, especially because we had a lot of language diversity represented. So we're hoping to restart now in 2021. We feel like we have a little bit more experience in how to do conversations like this, both in person and virtually well. And our intention is to bring back some of the customer representation, but also to be working with the farmers that we support as well.
Great, thank you, Grace. So Kathy had asked, as a school guidance counselor, I'm wondering if there are any particular ways that schools can assist in promoting HIP. I'll put that out to whoever wants to answer it.
I could answer the best I can. Here in Lawrence, the school invite us when they have parent-teaching conference. And now that we are in this crazy time, like last month, they did parent-teaching conference, like a Zoom meeting, and they invite me to present it about the food program we have and how could family know the different programs and that they have. So that's one thing that could help you involve. Check with the school, ask them to invite your local nonprofits who work like has farmers market, like food produce, as if it's in that location where food produce is, or Groundwork Lawrence, whoever is in the community working with food, or any information that you want to give it to your parents. Just contact them to ask them if they're willing to present it for a few minutes to the parents and stuff like that. So that's what we do here.
I would agree. And I would just add, I think that any kind of outreach to the schools, direct connection and focusing on the parents rather than the students is most effective, just because HIP is really a program that's primarily used by the people who are purchasing food for the household. So we found it effective to go to Parents Night for Head Start, or if there's a Parent Site Advisory Council, or any opportunity when it can be a direct connection to the parents or the guardians of students. And one thing that hasn't been effective for us, but that we've been asked to do a lot, is to bring the mobile market to dismissal. I will say it may be different in different communities, but at least for us, that is not a great time to try and have conversations with parents and to offer resources. Most people are really trying to get in and out at that time of day.
Does anyone else want to add to that? Okay. Becca, this one might be directed at you, but do you know what the increase in percentage of HIP users there are compared to past years?
Yeah, hey Anna. Anna's also an expert community-based outreach person in Boston. If you look at our fact sheet, we have one point on there that's, I think, from 2016 to 2019. It based on our sales data that we get from the state, SNAP sales at farm retailers increased by like 1,200% before HIP, the year before HIP to the first couple of years of HIP. So I don't have the, you know, the like increase in like numbers of SNAP consumers at farm direct points of sale, but I do have the SNAP sales data. So that's sort of like one way to gauge it. Also happy to talk offline, Anna, if that'd be of interest.
All right, I think that was all the questions I saw in the chat. Does anyone else have any questions for our presenters today? You're welcome to just come off mute since there aren't any other questions pending. You have just a minute or two to gather your thoughts. If not, we can share our information in the chat, and you can feel free to connect with us offline, any of the speakers here today. I want to extend a huge thank you to all of our presenters today, and to everyone who attended and is willing to support local farmers and HIP retailers and SNAP clients to get the word out about this program. So again, feel free to put your information in the chat, speakers, and folks can contact you. We will have a recording of this meeting posted online. Becca, I think you said that you would be able to post it on your YouTube channel. I'm getting a thumbs up, great. And I will send out a link to all of the registered participants once it's available. We'll also send out the slides if it's helpful for you to see those. So thank you so much again for joining us today. Thank you to our presenters, and happy shopping at farmers markets this summer. Have a good one.
Thanks, everyone.
Thank you.